When Analisa Latchman of Limasan's Essequibo was 10 years old, her left side face developed a deformity which grew bigger over the years. However, 6 months ago, she began experiencing severe headaches, which subsequently led to the loss of consciousness. After numerous CT scans and MRIs, doctors could not diagnose what was wrong with the young woman and only treated her for the pain, but no amount of pain medications worked. In early July 2020, her family took her to see neurosurgeon Dr Amarnauth Dukhi, who made the historical diagnosis. Analisa was diagnosed with craniofacial fibrous dysplasia, a bone disease of the face and skull that replaces normal bone with fibrous type tissue. At a press conference on Wednesday at the St. Joseph Mercy Hospital, Dr. Dukhi explained the rare disease.
We were able to detect that this is a patient that had one of the rare craniofacial bone disorder. So the diagnosis of Analisa then was what we call a craniofacial fibrous dysplasia. Now what happens here? It's an issue, or it's a pathology or a disease that occurs 1 to 5 in every 15 to 30,000 people that are born. So we're looking anything about 8 in every about 10 to 15 in every 100,000 babies that are born.
A surgery to replace 40% of the young woman's skull was successfully done at the St. Joseph Mercy Hospital in partnership with Neurospine Inc. on Saturday last. Dr. Dukhi explained that this was a first world surgical procedure that was done in a third world developing country. It was also the first time that someone with this disease was diagnosed in Guyana. The skull implant was procured from KLS Martin, a medical equipment supplier company in the United States. A 3D reconstruction of the patient's skull was sent to the company in order to create the implant to suit her facial structure to allow her to look normal again.
I did a CT scan, I reconstructed it 3D and realized that almost 40% of Analisa's skull was sick. That osseous structure of her actual skull vault has now become fibrous, and it was pulling her facial structure into the brain. Hence why she had an asymmetric facial look, where her left side was more into the brain and her right side of her face was where it should be.
Without the surgery, Analisa was likely to have severe brain damage, suffer seizures, and be in constant pain. However, the 6-hour-long surgery was a huge success. 4 days after the procedure, Analisa is already walking and talking and is no longer having headaches. Dr. Dukhi further highlighted that there was also no complications during the intricate surgery. However, with every surgery, there is some amount of risk, and Dr. Dukhi now explains what could have happened if something went wrong during surgery.
In Analisa's case, we had to be very careful with nerve damage, especially the facial nerve, which would have paralyzed her one side of her face. And as we enter the orbit here, there is the upper branch, or the V1 branch of the trigeminal nerve. If that is damaged, it's pain for the rest of her life. You end up with something that's called trigeminal neuralgia. So I had to find those nerves and dissect it away from the surgical approach. That was done successfully, so there was no nerve damage. In terms of removing the skull, I've suspected that there would be some issues with the dura. The dura is a layer that covers the immediate brain, and because the skull or the vault was convoluting and it was getting small, I suspected that the dura below, because of compression, would also be thin, very, very thin. And trying to remove that sick skull would have likelihood of damage was extensive. Fortunately for us, we were able to do a micro dissection away from it, and we had no surgical accident, as we like to say, or any surgical issues.
Analisa, who is the mother of a 5-year-old girl, will be discharged from the hospital in the next few days. The young woman is very thankful for everyone who supported her during this time and donated to make the surgery possible. The cost of the skull implant was $11,000 US and was made possible after numerous donations to her GoFundMe page. The hospital charges are being taken care of by prominent Guyanese businessman Chris Fernandes, and the surgical process was done free of cost by Dr. Dukhi. Analisa, during a telephone interview, says she cannot wait to return to work and be able to provide for her daughter.
Once I'm fully recovered, I will start working again because I'm a single parent and I have my daughter to take care of. Special thank you to Dr. Dukhi. because I've visited so many doctors and I got no help. But the first visit to Dr. Dukhi, he told me about surgery. And I must say I'm very grateful to him. And special thank you to the administration of St. Joseph Mercy Hospital. They did so much, and I must say thank you too. And special thank you to Mr. Fernandez.
It is expected that Analisa will lead a long and normal life. Dr. Dukhi was commended for taking healthcare to another level in Guyana over the last few years. The newsroom understands that on Dr. Dukhi's agenda is to perform a wide-awake brain surgery, another first for Guyana. Reporting for the newsroom, I am Isanella Patwa.